antiplatelet drugs. These include number 1, aspirin. This is a COX inhibitor, so irreversible inhibitor of COX. Then if it is irreversibly inhibiting COX, it is causing thromboxane, decrease in the production of thromboxane A2 release. So thromboxane A2 release, it is causing decreased release of thromboxane A2. That is the mechanism of action. Talking about the uses of this drug, these drugs are used in cases of acute coronary syndrome. Then this is also used in cases of stenting, decreased incidence or recurrence of thrombotic stroke. So to decrease the incidence or recurrence of thrombotic stroke, these drugs are used. Then adverse drug effects of these drugs include, because these drugs, aspirin especially, can cause gastric ulceration, tinnitus, and allergic reactions, some sort of allergic reactions, and it can also lead to renal injury. Okay, so next class of drugs, talking about next class of drugs, these include ADP receptor blocker, ADP receptor blocker, ADP receptor blocker. So all the drugs in this class are like grill. So in the end there is grel, and or it could be LOR or pidine. Okay, so it could be, in the end we will find one drug is colpidogrel. Okay, colpidogrel. Then next drug name is prazugrel. Then next drug name is tigagrelor. Then next drug name is ticlodipine. So these drugs, how do they act? They act by blocking this receptor, ADP-Y2 receptor, ADP-P2Y12 receptor blocker. Okay, and then these drugs decreases the expression of ADP induced GP2-3A. So decreases the expression of GP2-2B-3A. Then third class of drug include abciximab, abitifafibatide, okay, and then tirofiban. Okay, so the thing is that these drugs will have FIB in their name. Okay, so FIB in their name, that is they are acting upon FIB. Remember, from FIB they are acting upon fibrinogen receptor. They are acting upon fibrinogen receptor. Okay, then these drugs block GP2B3A. Okay, GP2B3A. Again, GP2B3A, similar in colpetegrol we had decreased expression, okay, decreased expression of GP2B3A, but here we will have blockage of GP2B3A. GP2B3A. Now the abciximab, this drug which is abciximab, this drug is actually, we have AB in the end, so this is a monoclonal antibody. Monoclonal antibody. In reality, this is a monoclonal antibody. So these drugs are used in cases of, talking about the uses, this is used in cases of unstable angina. These are used in cases of percutaneous coronary intervention. Percutaneous coronary intervention. Also, these are used in, and they carry a risk for bleeding. Okay, so side effect for these drugs include that they carry a risk for bleeding and thrombocytopenia. Thrombocytopenia. Third classes of drugs include which block the diesterase. Okay, fourth class of drug which we are going to talk about today is includes silastazole and dipyridamole. Okay, silastazole and dipyridamole. So these classes of drug, what do? They block phosphodiesterase leading to decreased cyclic AMP hydrolysis and increased cyclic AMP in the platelets. So these drugs are used in cases of, we'll use these drugs in cases of intermittent claudication, stroke prevention, stress testing, and prevention of coronary stent restenosis. Okay, coronary stent restenosis. These drugs can cause side effects of nausea, headache, facial flushing, also hypotension and abdominal pain. So talking about labeling the drugs here which we talked about, so we have, first we talked about aspirin. So aspirin was COX inhibitor. Next drug we talked about was dipyridamole and silastazole, which was again what? Phosphodiesterase inhibitors. Dipyridamole and silastazole. Okay. Next we said GP2B3A inhibitors. So these are the drugs which are tirofiban, abtifibatide and abciximab. mab. Next we said ADP receptor inhibitor. These include ticlodipine, colpidegrel, and tigagrelor. Tigagrelor. Then we have thromboxane. So this all is the disrupted endothelium जिसके ऊपर आकर के वॉन विली ब्रांड फैक्टर बीइंग एक्सपोज्ड एंड GP2B GP1A of one platelet it gets stick to the von Willebrand factor. Then with the help of fibrinogen there is a platelet aggregation happening and fibrinogen is an unstable plug. Okay, so inhibitor of the phosphodiesterase include dipyridamole and cilostazol, and for GP2B3A it include tirofiban, abitafaptide and abiximab, and ADP receptor these include ticlodipine, colpetegrol and tigagrelor. So one mnemonic here which we can use include that any drug this ticlodipine, okay, it is a ADP receptor. Okay, so this ticlodipine it's an ADP receptor, it's an ADP receptor. Okay, and ADP contains AD, and ticlodipine also in its name contains D and P. Okay, and it is an ADP receptor. It okay, ADP receptor we can write it as ADP receptor. Okay, this is an ADP receptor. It contains DNP. Also, ticlodipine also contains DNP, and colpetegrol also contains DNP. So that's one mnemonic. Another mnemonic is C. Abiximab, tirofiban, and all of these drugs. All of these drugs contains AB. Okay, and these are also inhibitors of AB. Okay, B. All of these drugs contain A and B or B and A. So, and this is a GP2B A inhibitor, and ADP inhibitor is ticlodipine. It contains DP, and colpetegrol it also contains DP. That's another mnemonic which we can remember.